Hi there, and welcome to the HFS Career Podcast. My name is Dr. Lori Bullock, and I'm an assistant professor in human development and family studies at MSU. I teach several courses in the department, and one of them is HDFS 270, which introduces students to this major and to the field of family science. Quite often, students who are new to our major are not quite sure of the career options they have with a degree in human development and family studies. Some students know exactly what they want to do, and some students aren't quite sure and can sometimes feel overwhelmed. And there are other students who are in our major but plan to pursue a career in the healthcare field. These would be students who know that they want to be nurses or doctors or child life specialists, occupational therapists, and so on. The purpose of this podcast is to bring professionals on from many different areas. Each episode, I invite a professional from the community who has a background in HDFS or one that is similar to HDFS. I'm so excited you joined the podcast, and I hope today's episode will be helpful to you as you consider your career options. Hello, HDFS students and colleagues. I have a great guest for today's episode, and I'm really excited for you to meet her. Her name is Autumn Ashley, and she's a doctoral student in the College of Nursing here at MSU. Autumn is in her second year of her doctoral student. She is a project coordinator for an HRSA grant promoting training and certification for sexual assault nurse examiners. Autumn graduated from MSU with her bachelor's degree in psychology in 2008 and then nursing in she graduated in 2007 with a degree in psychology and then nursing in 2008. Autumn worked as a hematology and oncology nurse at the University of Michigan Health System prior to completing her master's degree from U of M for nursing in business and health systems in 2013. Prior to joining the MSU College of Nursing project team, Autumn worked as a patient care director at New York Presbyterian Hospital, managing a team of nurse professionals. Autumn lives in the East Lansing area with her 2 children. Autumn, thank you so much for joining the podcast today and being able to share your experiences. I'm so excited to have you here because for my students to learn from you. I had mentioned to you before, we often have nurses or students who want to go into nursing after graduation. So I'm happy that you could be here today to share your story.
Thanks so much for having me, Dr. Bullock. And I'm so happy that maybe I'm reaching someone who might be interested in nursing because it's been an amazing profession for me and continues to give lots of different opportunities, some you could never even think of. So I'm very excited to share my experiences with all of you and go green.
Yeah, absolutely. Go white. So my first question to you is, can you tell us a little bit about you and a little bit about your role or your career in being a nurse?
My pleasure. So, like Dr. Bullock shared, I was at Michigan State for my undergraduate degrees. I started off in psychology with a different focus originally and changed my mind and moved into nursing. And I was in the second career program at that time. It was just a 12-month program. So I graduated the following May after my initial bachelor's degree. After that point, I had so many wonderful experiences during my clinicals and meeting so many different patients. I had a hard time kind of deciding where I wanted to land in nursing, but one of my final rotations was in oncology, which is caring for cancer patients. And I remember just the patients who I interacted with were so kind and generous. I remember one woman, I was accessing her chest port and she's like, "Do you want me to write you a letter of recommendation for a job?" I was like, here you are getting treated for cancer. You're in the middle of a hospital. I'm poking you with a sharp needle and you're thinking about writing me a letter. And I just remember that, like, even though it's been, 100 years now, it feels like since that time, I remember that interaction and thinking like, how amazing. Like, I want to be able to take care of these patients and their families. So then I found a position at University of Michigan. I think it's Michigan Medicine now, but in their health system on an oncology unit. And we primarily cared for gynecological oncology, hematology oncology. So that's leukemia, lymphoma, and then medical oncology. So anyone coming into the hospital for cancer care. So most of cancer care is actually given outside of the inpatient unit, but the patients that we were treating had to receive inpatient care due to the severity of their illness or needing to be like closely monitored. So through that time, I loved the different opportunities as a staff nurse, being charge nurse, joining different communities, working as a team, you know, like the bond that I have, I still am like very close with 3 girls that I worked with, you know, since 2008 at U of M. We still connect, we still get together now. We bring all of our children with us when we see each other. But it's just that bond and working together as a team in a very tough setting sometimes has been, you know, so amazing for me as a nurse. I had an interest in becoming a leader as I really enjoyed kind of mentoring and growing people. And even though I wasn't formally in that role, I found a program at U of M where I could, you know, maybe kind of transition into a more formal leadership position. So I graduated from University of Michigan with my nursing business degree and then went into nursing leadership. So I was a nurse supervisor at first. At U of M, actually on the unit that I worked at, which had its own, you know, interesting dynamic.
Yeah.
And then my husband and we moved to New York City, and so became a patient care director for a unit, also hematology oncology. I got very fortunate with that. And was able to manage a great team. And, you know, the team when I came was very disconnected. We had a lot of turnover. And then over the time that I spent there, we were able to grow like a family of network. And I have my old nurses from New York City still texting me when it's my son's birthday, because we were able just to create like such a great bond. I mean, especially going through the pandemic and whatnot together, that also brought us all super close. But had a great opportunity to lead an awesome group of nurses in New York City. And now I'm back in the East Lansing area and serving as a project coordinator, which might not be a typical role that you think of a nurse in. But the grant that I'm working for is training sexual assault nurse examiners in rural and underserved areas of Michigan. So a lot of my leadership skills that I've been able to grow over the years have helped me really build this program with my team. Not that I have training as a sexual assault nurse examiner myself, but we have content experts. I'm more doing operational stuff. But I get to connect with nurses all over Michigan and, you know, very rural areas that I don't even know what county, I can't even pronounce the county's name, but it's very fun to meet them and work with them and help them on that trajectory. So that's kind of me in a really quick nutshell. I talk very fast, but I do have 2 children. I have a 5-year-old and a 2-year-old, and my husband here. My family is close by. That's kind of what brought us back from New York City, just to have a little bit of extra support with the children.
Yeah, that could be helpful. You have a really full life, a lot on your
Yeah.
plate. Yeah. Thank you for sharing that too, because it really shows the diverse experiences you can have as a nurse, right? I mean, you
Definitely.
have done a variety of roles, you know, both on the floor and nursing, and then moving into that leadership role.
Yeah,
So
definitely.
yeah,
Mhm.
that's great. And it shows your ability as a nurse. Like you said, you kind of brought your nurses together.
Yeah, you know, it's nursing is what you have to be a leader to be a nurse, in my opinion, because you have to be able to advocate for your patients, your families. You have to be able to be on your game and identify when things change. But there's also just so many different avenues you can take. There's so much that nursing offers. So
Yeah, it really does. And like you mentioned, kind of tough circumstances sometimes. I mean,
mhm.
I've seen it when I've been with family members who are in the hospital, of sometimes the tough positions that nurses have to face, or advocating for their patients. And that can be so important.
Very much so. And self-care, really like having a network of people to, you know, to work with, to talk with, to cry with if you need to laugh with. You know, sometimes probably what we're laughing at is a little bit inappropriate, but it helps, you know, times, you know, people cope with, you know, the emotion that you're seeing and a part of every day.
Yeah, I mean, humor sometimes just helps with that.
Yeah.
Cuts the tension sometimes. So can you talk a little bit about, you know, what made you choose this career path? You said you started out in psychology. Was there like a turning point or a defining moment that for you that made you want to change into nursing?
Yeah. So really, when I think back at this, there was like two kind of things, one more of a joke and one more real, but essentially I was on the path to become a dentist and I was doing pre-dental. So, but I chose psychology because I'm very interested in like just the mental health and it's just very interesting to me. And so I chose that as my major and then I was taking all of the pre-dental requisites. I was also volunteering at a nursing home, Bertram Hills in East Lansing. And it was so much fun. I was like, not that this is what a nurse does, but I was like teaching tap classes to, the patients there. I got to like help one woman who couldn't see, like shop online. And like, I just really liked being able to connect with people on a more human level. And, no one likes going to the dentist. It's like I was working in a dentist office over my summers. And, like I love dentists, there's no problem. But I was like, I really want to be able to talk to people more so without things in their mouth and having that, like I want that back and forth relationship. I really enjoy that. So that was kind of like a point. Also physics. I didn't like physics. Just more of a joke, but I didn't want to take any more physics. But really, I really wanted that like human connection with people.
Great. Yeah, thank you. And then from there, it sounds like it was kind of a progression from nursing to leadership to, and still staying in the nursing field, but then
Yeah.
going into and some administration too, I'm assuming.
Yeah, so my position as a patient care director was like a nurse manager essentially, where you're like leading a team. I managed one team most of the time, and then I would cover other departments and stuff as the need would come. But when you start being a nurse, you really find like your interest in what you gravitate towards. And oncology is such a specialty. And when I'd be interviewing nurse candidates, like you really have to want oncology to be successful in this position, and I would really try and talk to them about like where their interest is or help guide them even when I'm interviewing for my job. Like, it sounds like your interest might align more over here. So there is a lot of different opportunities, but for me, I really found myself gravitating towards like being that, like listening or helping people, like mentoring people, promoting difficult conversations with either colleagues or whatever. So that's kind of why I fell into that leadership, because I felt like I had an opportunity to kind of like share my knowledge a little bit broader. And then now as a PhD student, I'm even broadening my scope now more so, hoping that I can help from patients across the board through research and their families manage, cancer survivorship and not, not just at one specific level. So it's kind of, as I've grown up and learned stuff, I want to continue to like be able to help people from a wider. So I guess my horizon started small, one patient at a time, not one patient, but a handful of patients for the shift, then kind of growing into the leader where you have this accountability across the board 24/7. And then now into this, hopefully, where I'm, maybe, promoting different interventions that help family across the globe with their cancer survivorship.
Yeah, it sounds really interesting and fulfilling.
Mm-hmm.
Yeah. Um, so my next question, what advice do you have for students who are interested in pursuing a career in nursing? Where should they go if they're an HDFS major and they want to go into nursing afterwards? What do you have some advice for them?
So I think if you have the opportunity to be able to shadow, that's always a great way to kind of see what the reality is of being a nurse, because it's not easy work. It's kind of, it might be a little bit harder now with COVID and restrictions. But I still know that I've heard different hospitals around the place do allow people to shadow. So I think that's a great opportunity. Volunteering with people, I think, is also a great way in a care setting, some kind of care setting, to be able to kind of observe and see what's going around you. Where's your interest? What do you think would be fine as far as like really landing? Okay, is this the right career path for me? I was a second career program. I had a great learning experience. I loved it. You really bonded with your group. It was super hard work. And I remember like crying to my dad. I was like, I'm going to make it out of the first semester. I made it out of the first semester. And I continue to make it. Feels really tough when you're in it. Definitely. It's hard work, but it's so worth it and so rewarding. So I think HDFS, like I remember I took some family development courses and now I'm again back in HDFS taking some more courses, because the patient and family the patient comes with other people in their community, whoever they identify as their family, they come with them. And it's really important to have an understanding of family dynamics and how you communicate with family, or even looking at families that are dealing with a hard time and not managing their stress, and how you can step in and help them. So I think it sounds like the students here in this group are having a great start that could really help benefit them going into a nursing career, and they can use everything they're learning here to, kind of move forward.
Yeah,
Does that answer your question?
it does. It does.
Okay.
Thanks. I think that'll be helpful for them. Um, can you talk a little bit about networking and building connections in the field? How would you recommend students network as they want to go into nursing, and then once they're nursing, what are some different ways that nurses do that?
I think, reaching out to, let's say you want a shadow, and maybe you're very interested in pediatrics, kind of developing a relationship with maybe a community hospital, or wherever you're geographically located, a setting where you might be able to develop that relationship with a nurse manager, for instance, who might be able to help guide you along the path, might be a really good idea. I'm not sure of how the application process goes, like to be admitted into the program, but nursing, we have a lot of nursing research going on, for instance, in our College of Nursing, and we hire students all of the time. Sometimes nursing students, but often we open it up to a broader perspective of other students. So if you're really interested in learning a little bit more about nursing research, for instance, maybe signing on for one of those, I don't know if they're called RA positions, but those student research positions could be really helpful and beneficial. And you could learn about, a lot of the work that's happening as nursing in the community, looking at public health crisis, like obesity and physical activity, looking at school systems. So it's very, very relevant and very important for the community that we serve. So that would be a great avenue. And then you're building those connections through that. I think that's the main key. Like if you meet someone, take their name down, follow up with them, circle back around with them, and don't be afraid to reach out and ask questions. You can always ping someone and say, hey, I'm really interested in nursing. Can I shadow a class for a day? Like people are very open just to, well, we need nurses greatly. So please come on down. But those would be like a few tangible, opportunities I would say might help you network. And then as I grew in my leadership experience, I tried to maintain relationships with key people, or key important people to me, as much as I could. It's hard when you're traveling around and you get busy, but key people that really interacted with me and influenced me. Like I had a professor at University of Michigan. He also worked per diem on my floor as a staff nurse, just to stay connected. But I still connect with him, even though it's been many years, just to hey, how are you doing? Just to keep that connection, because I know that, I'd love to collaborate with him someday, for instance, kind of thing. So.
Yeah, those are great ideas, great concrete ideas too. I like the one about, looking into some research projects here at MSU. And that's a really wonderful idea because, like you said, you build relationships as well as gaining that really valuable experience. So, and a way to kind of test the waters, as you mentioned, is this an area I'd be interested in? Even if it's a research about a certain area of medicine or anything like that. So I love that. And then the connections that you make along the way and keeping those. I think we've talked a little bit about this in some of your answers about what advice you would have for students who want to pursue a career. You kind of mentioned shadowing and becoming involved in some aspect. So
yeah, I think those are definitely key. Talking to nurses, like if you have nurses in your family or just around, or other student nurses, I'll give my contact information. I'm always happy to just talk about my experience and, really in a real way, like the goods and the bads, kind of thing. So
yeah.
I think really just finding out as much as you can. I think the other advice I would say, when I was thinking about this question, and I was kind of coming up when I'm working on my own research practicum, but I think I would have liked to have been able to take some opportunities within the institution, the university, during my undergraduate. So I worked as a server at Max and Irma's, because I needed money. So, while I was in college. but I wish I would have looked more at these research opportunities or different positions within, because then you get that exposure, that networking, you get a little bit of training, like, so you're learning a little bit. It's not to the level where you're having to, like, turn something in at like an assignment, like more schoolwork, but it's a good way to like connect and stuff. I had a great time being a server and I really liked their tortilla soup, but it's also like, I kind of wish I would have maybe used that time a little bit more valuable to then help promote my career,
Yeah.
but
Yeah, I could see that where that would be valuable. And maybe some of the clubs, I think there are some clubs that some
yeah,
nursing students get into
exactly.
that are
Yeah.
helpful. Good. All right. So I think we cover this next question too. So what do you see for yourself in your future in terms of your career, your PhD program? So what's kind of on the horizon for you?
So first I have to get through all my coursework, and then like pretending I get through my PhD program here in the next few years. I can see myself kind of landing back into a health system. I really love being connected with patients, but to be able to do research within a health system. So there is some, like at my old position at New York Presbyterian, there was a nurse researcher. She could do her own research in partnership with obviously many people, but could also help promote nursing research at the bedside level, looking at quality improvement, evidence-based practice. So to be able to kind of have like a direct impact as well as a global impact, I think would be a great combination. And then maybe eventually down the road, looking at being a faculty, but I don't know that I'll go right back into academia right away. My
Yeah.
answer could change, in like 2 weeks, but this is like where I'm at today.
Yeah, absolutely. Yeah, I can
One
get
day at
that.
a time here.
Yeah, I get that. So yeah, you want some more out in the field experience and incorporating research into it and then possibly academia later. Yeah, that makes sense. So my last question is whether if it's okay if students contact you. You mentioned, it's okay to email you.
Yeah, you're welcome to share my email. And if anyone has any questions or just wants to chit chat about nursing or how I got like my experience in the second career program or how I transferred, whatever it is, I'm happy to share my experiences if anyone wants to hear me.
Okay, that's great. Yeah, thank you for that. I'll put a description in the description episode about the description about the episode. Sorry, I can't
Okay.
talk
Yeah.
today for some reason. So I'll put your email address in there so students can connect with you if they have some questions.
Perfect.
All right, awesome. Well, thank you again for joining me today. And it's been really fun having you on the podcast. Thank you for walking through your journey and explaining it to our students. I really appreciate it. I know it's going to be valuable for them.
It was my pleasure and my honor to be able to do this. I was like, oh, this is so fun. It'll be able to, reach people I will never know, but maybe they'll see me on the campus and say, hi, Autumn, I saw your podcast.
Yeah, that would be awesome.
Mhm.
All right, cool. Well, thank you so much.
My pleasure. Thanks, Dr. Bullock. Have a great day.
Yeah, you too. Thank you again for listening to today's episode of the HCFS Career Podcast. I hope you enjoyed meeting Autumn and learning about her career journey as a nurse and just understanding the variety of routes a nurse can take in their career path. It's just awesome to hear about. As I mentioned in their interview, or we talked about in the interview, Autumn's contact information will be in the episode description. She would be happy to answer any questions you might have about pursuing a nursing career. Please join me again soon for interviews with other professionals to learn about the many options you have available to you as you're pursuing this degree. I hope you enjoy the rest of your day.